medicine was at one time a second choice for me. When I was in high school, I was a competitive swimmer, and I had aspirations of being a lot better than I was. And as it turns out, my mediocrity was fortuitous, because I realized I would never achieve the things I thought I would. And had I been a better athlete, I probably would have gone into some physical education program or something like that. I always enjoyed or liked the concepts of physical training and muscle strength and training and things of that sort, and I thought medicine would be a good choice. So I enrolled my freshman year at the University of Illinois in Champaign-Urbana and as a pre-medical student. Now, the next most important thing that occurred, I was driving with my parents. My father was sitting in the front seat and mother, sister in the back seat, and we had a serious automobile accident. There was a woman, these were all two-lane highways, and there was a woman that fell asleep at the wheel and came up over a hill and got off on the shoulder and attempt to get back on. There was a ridge there, and she ended up hitting my car directly in the driver's side, which I was driving. So at the time, I broke my left elbow, and the frame on the front door was bent over and trapped my foot, and I had a serious soft tissue injury there. At any rate, I spent 2 weeks in a hospital in Vandalia, Illinois, and obviously I missed my first semester in college. I ended up spending a little more than 2.5 years in college before I went to medical school. My wife and I were married a month before I started medical school. One of the other things that I got from the accident was a financial settlement, which helped me pay my way to medical school. And anyway, in medical school, I had no great knowledge. We didn't have anyone in my family that was in the medical profession, but it became fairly obvious to me that I wanted to be a surgeon, and the event that cemented that interest was I was a second assistant a third assistant, which meant I just held retractors on the first abdominal aortic aneurysm resection that was performed at Cook County Hospital in Chicago. Well, I got out of medical school and I went to Milwaukee to enter a general surgical residency program, which I thought I wanted to pursue. Well, I was a resident for about 7 months and was drafted into the United States Air Force. Now, that's sort of an interesting story, too, I think, because in those days, they could not force you to be an officer, a gentleman. That was not part of the draft law, and so I got a letter from the government saying you can go in the Air Force as a captain, or you can go in the Army as a foot soldier. Well, that's a pretty easy decision, and I spent about 2 years in the United States Air Force in Bangor, Maine. I ended up missing the Vietnam War by about 3 months. That is, missing going over to Vietnam. And while I was in the Air Force, I was at a 50-bed hospital, and I was given basically the job of doing the orthopedics. It was pretty straightforward orthopedics. A lot of healthy young people, some children's fractures and things, and I had a fantastic civilian consultant in town named John Woodcock, and I would go and see John once a week or so, and with my stack of x-rays, he'd review them and say, well, that's fine, but maybe you ought to do this, and I better come out and help you with that. And that, again, made me seriously interested in orthopedic surgery. my opportunity to teach orthopedic residents basic science. And as it turned out, that was a very successful endeavor. When I took over the program of teaching basic science, particularly, and other aspects of orthopedics to the resident, our residents were in the low 30th percentile nationally. And after a couple of years, we had consistently, for almost 10 years, our residents in the 90th percentile. So I was very proud of that accomplishment. I also have 2 publications that are first, and they're case reports, and one is related to using bone scanning to diagnose a condition called osteoid osteoma, and the other is that I have the youngest case of Lake Perthes disease and a 20-year follow-up, and this is the youngest patient that is ever documented in the literature. The other thing is I've never been sued. Well over close to 98-99% of physicians in their career are sued, and it's particularly prevalent in people that did the kind of surgery that I did, which was spine surgery of all types. And somehow I got through it. Surgery is a skill which is very enjoyable. I certainly did. But I think it's awfully important to understand why a fracture heals, what happens when you have a tumor or an infection, and I think you have to understand the basic science behind that if you're really going to be a complete and good orthopedic surgeon. I was lucky to get out without them throwing things at me, but I think you have to be honest and straightforward. I think you should never back down on what you consider is the right thing to do. I think you should accept challenges as an opportunity to learn, and criticism in the same way. And when you back away from those challenges, criticisms, you have missed a great opportunity to reevaluate your own thoughts. And there's nothing wrong with being wrong, but to stubbornly stick to something that really you can't defend, I think, is inappropriate. 12 grandchildren now living, 12 grandchildren. I hope they will have some interest. I do have my youngest granddaughter actually is a freshman in college, and she's going to, is planning to enter a career in medicine. So, and I have a daughter that is a full professor of radiation oncology at the medical college. I hope she'd be interested, and I hope my other children would be interested in things I have to say. I think one of the problems is that over the years, so many conversations that are somewhat spontaneous and not well thought out can result in people understanding what my true opinions are. The most important person in my family was my wife, and again, we got married. We're both 20 years old, and a year before I started medical school, and that was against the advice of everyone, and if I were my parents back then, I would have advised against it. But it turned out to be a tremendous opportunity. We spent, my wife was killed in an automobile accident exactly 1 week before we would have been married 57 years. And my devotion to her and the fact when I really became, she and I became more, spent more time together and became, helped me develop a much more serious attitude towards the future. And she has supported me in every way, and in her own right, she has had a number of very accomplishments herself, which I'm very proud of. And we had a fantastic marriage. We had the opportunity to travel the world over, up the north and south, in the East and the West, and she was very instrumental in a lot of that. I wasn't, I still am not terribly much interested in just going to see things. I'd like to go someplace and do something. So she encouraged me to expand my horizons with travel and so forth, and that was fantastic. So she's by far the most important person and supportive in my family, and of course we had 13 grandchildren, and unfortunately our oldest grandchildren was killed in Iraq in 2005, but my whole family has been very supportive and helpful to my career, and inspiration, and a reason to purpose in my life, to work, to achieve. I wanted them. I didn't want them ever to be ashamed of me, and I hope that they got awful mad at me a number of times, but I hope they're not ashamed of me.